Hello, ladies. My name is Tish. I am a registered nurse at Mount Washington Pediatric Hospital, and I am here to talk to you today about the importance of prenatal care and the resources that are available to you to be able to access that prenatal care. So at my job, I see a lot of the effects of the lack of prenatal care in our community here in Baltimore. So I feel that this is something that's very important, and I do want to thank you for taking the time out of your day to come and see my presentation. I plan on doing this at different locations throughout the city, so if you think it's good, go ahead and let your friends know, and they'll be able to find out where the next time I'll be doing it is. So just to start off with a few statistics about prenatal care and what happens if you don't get prenatal care. So 17.2% of pregnant women surveyed across 30 states report receiving no or delayed prenatal care. I know that doesn't sound like a huge percentage, but if you think about the amount of women that have been pregnant in the past year, it's if it's the same as me, it's a lot. And when you kind of look at that, that's almost 1 in 5. So of the 5 pregnant women that one of those women is not getting the proper prenatal care. And the shocking part, and the reason that I'm here talking to you ladies today, is that 53.6% of that 17% of women is 25 years or younger. And the biggest issue at 38.7%, why they're saying that they're not getting the prenatal care, has to do with money and insurance. So next, just to kind of go over the importance of it, in case you don't know. So obviously, the biggest thing that we all want as parents is a healthy child. And when you don't get prenatal care, you put that at huge risk. So, the things that happen when you don't get or the risks that happen when you don't get prenatal care. The biggest thing is preterm and low birth weight babies. We see a ton of this, and the problems that come with that are apnea, which means they stop breathing, bradycardia, their heart rate drops or stops, oxygen desaturation, so their blood is no longer carrying oxygen, chronic lung disease, respiratory failure, intrauterine growth retardation, and all of these things can lead to developmental delays throughout their entire childhoods and into their adult lives. And as far as how it, affects you immediately, this is all extended hospital stays. You don't get to take your baby home. Your baby has to stay. They may have to come see us even after they get out of the NICU. They come to us, and, they have to learn how to eat. They don't know how to eat because they didn't get the developmental skills that a full-term baby would to be able to know how to eat. They can't maintain their temperatures because they don't have the fat to, be able to keep their temperatures up. All these things. So, it might be 4 or 5 months before you even get to take your baby home, and nobody wants that. Not to mention the health of you as a mother. So a lot of prenatal care is health screening and health prevention. So, you're getting the vitamins that you need to support your body while your body is growing a person. And you're getting the prophylactic care. You're getting antibiotics to prevent infections. You're getting, if something does come up, you're getting early and quick treatment, so that it's not something that's going to affect you in the long term or your baby in the long term. So it's a pretty important issue and pretty important to have prenatal care. And in Baltimore City, there is really no reason that you should not be receiving prenatal care. Baltimore has a ton of resources. I got the top 3 that I thought were the most helpful after researching it. So the first one I'll bring up is Baltimore Healthy Start. What that is, they do home visits, they provide transportation to and from doctor's appointments, and a lot of that's really important because I know that a huge issue that comes up a lot on why people aren't getting prenatal care is transportation. So, they're taking that out of that. They're coming to you and they're making sure that you get to the appointments that you necessarily need to, as opposed to somebody coming to you. Another great thing about them is that they offer a lot of postnatal. They offer a lot of postnatal resources as well. So, say you're thinking, oh, I've just had a baby, I want to better my life. They offer GED classes. They offer parenting classes. It's a wide array of things. That they offer. All of these resources I'm giving you, by the way, I will put their website and their contact information in the information below the video. So feel free to go check all of that out. And for those of you with me live today, I will have printouts with all these resources that are available to you. So that's the first one. The second one, and obviously the most used, is the Baltimore City Health Department. They're open Monday through Friday, 8:30 to 4:30. So you can go walk in and get information. I've also attached all the contact information for them as well. Specifically their maternal and infant care program. So they provide a lot of counseling services as far as making and keeping your prenatal appointments. They do care coordinating, so they're coordinating with your doctors to make sure that you're getting all the care you need, as well as keeping it convenient. You are also provided with support from medical personnel, so nurses, things like that. Social work, if you have any kind of need for social work, counselors, and volunteers as well. They also have parenting guidance classes, so if this is your first child, that's a great resource just to kind of know the things that you may not, as a non-parent, know, that safe sleep stuff, all sorts of stuff. And then there's also WIC assistance through them, so what that's going to give you throughout your pregnancy and while your child is growing and developing as well is healthy foods. They do health screenings and super great lactation counseling. That's something that, if you are considering breastfeeding, whether it be for the health of your baby or to save a little bit of money, being able to have access to a lactation counselor is great because it can be a huge, huge challenge. They also do referrals to specialists, and all of this is available to you regardless of whether you have insurance or not. That is that. And then the third resource that I also thought was really great was healthybabiesbaltimore.com. So this is Healthcare Access MD. It's a resource of theirs. So what they're going to do for you, they're going to find the prenatal care resources for you, kind of how it's similar to the Baltimore City Health Department. So they're gonna find the appointments for you, find the doctors that will take your insurance, or if you don't have insurance, that will be providing care without insurance, all that. If you are homeless, they will find shelters that accommodate especially for pregnant women. If you have substance abuse issues, they provide counseling for getting help with that, because you want to have the healthiest baby possible. So we all know, don't do drugs while you're pregnant, but it's easier said than done. So they do provide counseling for that. Immigration issues. So if you're nervous about receiving care because of the fact that you're here illegally, they can help you out with that as well. They also have mom support group access. So you can, it gives you a resource to be able to find women who are in the same position as you. They're pregnant, they're having babies. They're accessing these resources as well. So, it's a little different than somebody who has more means than you do. They're going to have a whole different set of issues than you are. This is connecting you with women who are going to understand the position that you are in and kind of be a support system for each other, which is super important, especially if it's your first child. They also offer the breastfeeding support groups. They're led by lactation counselors. Once again, can't stress enough how great of a resource that is. Like I said, it can be a difficult, challenging thing, and having a lactation counselor be willing to give you their time and do that is amazing. And then they're going to provide you educational resources. There are videos, there are information packets regarding all different topics: breastfeeding, smoking cessation, safe sleeping, CPR, all sorts of things that you'll need to know as a new parent. And then they also do postnatal health for mothers, which is another thing that's great, because a lot of what we're looking at with like the prenatal thing is focusing on the baby. We're not focusing on the mother. So your health is important too, and what this is meant to do. Not only do they want you to stay healthy while you're pregnant, eating the right foods, getting the right exercise, they want you to healthily return to your normal self after pregnancy. And they provide classes for this, whether it be for weight loss, whether it be for eating, working out, whatever it may be, they provide this. I think this is really, really a fantastic resource. And they do have 3 locations throughout the city. There's one in Highlandtown, there's one in Druid Heights, and there's one in Cherry Hill. And as I said, all contact information and websites will be available in the comments below. So those are the top 3 resources that I found. And to be honest, ladies, I Googled, I just to find out what's out there. And so it's as simple as that, being able to find it. And if you're not in Baltimore, if you're watching this online, this isn't one of my live presentations, Google it in your city, see what's available to pregnant women, and it comes up with a ton, and it's as simple as that. So the next topic that I'm gonna get to is health insurance. There's a lot of reasons for people not having health insurance, but there are no good reasons. So what you want to do is you want to go and you want to get health insurance right now, whether you're pregnant or not. Reason being for this, and why it is important to our topic, is that if you have health insurance, whether it be state assistance, whatever it may be, you have health insurance, and it is there, it is in place, so that as soon as you are ready to, you can start your prenatal care. You're not having any sort of delay because of lack of insurance. It's all set, ready to go for you. Yeah. And if you're not sure about how to get insurance or how you're going to afford insurance, you can use the website marylandhealthconnection.gov. That's great. All you do is fill out your information, and it gives you a list of plans that are available to you. Little to no cost. It all depends on your income. So there's that. You can also call them and speak to a person if you don't have access to a computer. Public libraries, they have computers you can use. All right. I think that just about covers everything. I know it's short and sweet, but it's a lot of information, and there's so much available, and I really, really, really urge you to go look at these resources and make yourself aware of them. And even if you shove this in your kitchen drawer at home or in your backpack, whatever you do, keep the resources available, because if you do get pregnant, or somebody who gets pregnant, this is a huge thing for them, being able to get the prenatal care that them and their baby need. We don't want anybody to miss out on it just because they don't know what's available to them. You have everything at your fingertips, and we can avoid a lot of hospital time, huge risk of death or severe illness of these babies that are not getting prenatal care. That can all be avoided. So once again, thank you for your time, and I hope you enjoyed the presentation. I hope it was worth your time, and tell your friends they can visit my website and see where I'll be throughout the city if they're interested in hearing this too. Thank you.